Good morning, afternoon, or evening to everyone, depending on when you're watching this. Today's lecture focuses on one of the most powerful aspects of psychiatry and the most underappreciated, the psychotherapeutic framework. That should inform every single patient on every single encounter is a therapeutic moment, whether your visit is 15 minutes for medication follow-up or a full therapy session. Every interaction has that potential. And the way you listen, structure the session, and respond to patients can transform a routine medication management visit into a therapeutic moment. Our core objective is to give you the idea that even physician assistants and young clinicians can develop this framework and turn brief visits into meaningful and healing encounters. Psychiatry is not just prescription management. It's about understanding the person behind the symptoms, their inner world defenses, and their relationships. The purpose and power of psychotherapy has four core purposes. First, it promotes insight and self-understanding. We help patients recognize patterns in their thoughts, feelings, and behaviors, especially those operating outside awareness. When patients can see themselves with curiosity instead of judgment, they begin to change. Second, psychotherapy provides corrective emotional experiences. In our office, patients find something new, a safe, a boundaried, consistent relationship where they expect judgment. They find acceptance, and where they fear abandonment, they find continuity. Third, it integrates affect, cognition, and behavior. We help patients connect feelings to thoughts and thoughts to actions, restoring a sense of coherence. Finally, psychotherapy builds an alliance for change. Evidence shows that the therapeutic alliance itself is the strongest predictor of outcome. Our consistency, empathy, and engagement create the secure base that enables patients to explore painful truths and take emotional risks. A very interesting psychoanalyst, Harold Lang, has several psychotherapeutic principles. Harold Lang was a psychoanalyst who studied how therapists and patients communicate on a conscious and unconscious level. His principles help us find depth in even brief encounters. The therapeutic frame. Predictability and consistency create safety. Start and end on time. Maintain a structured format and gently address any breaks in the frame. As clinical data, for example, when a patient is late, explore what that might mean emotionally. There's two levels of communication here. Every statement has a manifest content, what is said, and the latent content, what is meant. A flat "I'm fine" might mask hopelessness or resentment. Reality versus fantasy. Translate stories about others into possible self-reflections. A patient angry at a boss may actually be describing feeling controlled by you or by their illness. Containment. Your calm presence regulates the patient. Don't suppress emotion, hold it safely. I can see this bringing up strong feelings. Let's pause and understand what's happening. Therapist self-awareness. Notice your own emotional reactions. Irritation, boredom, or guilt often mirror what the patient is feeling, but cannot express. Supervision and peer consultation turn these reactions into valuable diagnostic data. The energy you feel from the patient is the energy you may be able to interpret. Knowing yourself and how you feel in a session is awfully important. Supportive psychotherapy, the foundation. Supportive psychotherapy is the backbone of psychiatric care, especially in medication visits. It focuses on strengthening adaptive defenses and helping patients maintain function during stress. We do this by reinforcing ego, strength, and reality testing, fostering hope and self-esteem, maintaining function in daily life. Our stance should be warm, active, and consistent. And supportive techniques are more like a coach than an interpreter. We validate effort and build confidence before challenging defenses. Supportive techniques include alliance building, realistic reassurance, clarification, encouragement of affect, gentle advice, reflection of progress, and limit setting. What is a process note? The psychotherapy process note. Documentation matters. SOAP note records symptoms. SOAP notes are just for symptoms and plans. Process notes capture the mental work of therapy. Themes, defenses, interventions, and alliance movements. A SOAP note might say patient reports depressed mood, continue sertraline 100 milligrams. A process note adds explored patient's sense that nothing will ever change, linked hopelessness to depression, voice, offered supportive reassurance, alliance maintained. These notes reflect our clinical thinking and justify psychotherapeutic billing. A range of therapeutic interventions. Psychiatric practice requires a toolkit of interventions matched on patients' ego strength. Supportive interventions, validation, encouragement, psychoeducation, expressive interventions, gentle interpretation, and linking past to present. Behavioral interventions, activation exposure, and structured assignments. Cognitive interventions, restructuring distorted thoughts with Socratic questioning. Interpersonal interventions, addressing relationship patterns and role transitions. Always match the depth of the patient's capacity to support before interpretation. Constructing the medication management session. Even in a 15-minute follow-up, it can be therapeutically rich if it's structured properly. Opening and rapport, greet warmly, observe affect and nonverbals. Interval history, track symptoms and function systematically. Ask about function, not just mood scores. Move beyond checklists. What's been most difficult emotionally? Therapeutic mini intervention. Use reframing, validation, or behavioral suggestions. Medication review. Collaborate on decisions, address meaning and fears around medication. And closure. Summarize gains and reinforce continuity. We'll keep working on this together. Each visit should contain a moment of empathetic connection and clear direction. Langsian principles and brief visits. Even with the limited time, Langsian ideas apply beautifully. Predictable structure builds safety. Listen for latent meaning beneath words. Maintain containment through boundaries. Be the emotional regulator in the room. Notice your own reactions as clinical data. A clinical example is, let's see this action. A patient says, my sleep is better, but I feel empty. You validate the feeling, reflect on anhedonia, and explain as depression lifts, awareness of disconnection may emerge. You reframe this as progress and set a behavioral goal to resume meaningful activity. In 5 minutes, you've integrated supportive, expressive, behavioral, and psychopharmacological work. Synergy between psychotherapy and pharmacotherapy medication and therapy are not competing approaches, they are complementary. Medication creates biological readiness for psychological change. Psychotherapy builds insight and meaning around that change. However, they produce greater functional recovery and prevent relapse. Key takeaways. The interview itself is therapy. Maintain structure and containment in every visit. Document the therapeutic process, not just symptoms. Each follow-up is a micro-session of supportive psychotherapy. Always balance biological and psychological formulations. In psychiatry, our words, our tone, and presence carry as much therapeutic power as the medications we prescribe. By approaching each encounter as a psychotherapeutic opportunity, you transform the practice of psychiatry from symptom management to human healing. Remember, your consistency, curiosity, and containment may be the most powerful medicine your patients receive. Thank you. Till next time.